Namaste everyone. Warm welcome to our Ask Me Anything session today, where we are focusing on this very important yet not so discussed topic, which is constipation. So how do we understand more about this? And this session is meant and conducted with an aim to educate the masses. And December is designated as Constipation Awareness Month. And discussing about constipation is many times a taboo with many people in the society. And we see that people are not really very comfortable, but we want this awareness to be spread so that people understand that discussing about it is very, very essential. So let's understand more about this. Dive into this topic with Dr. Rajneesh Vigiri, who's here with us. He's a very well experienced Ayurveda physician with over 25 years of clinical experience. And presently, he's working as a professor and HOD Department of PG Studies in Shalyatantra, which is surgery in SDM College of Ayurveda, Udupi. So I welcome you, Dr. Rajneesh, and thanks for taking time out and joining us today. He has completed his BAMS in 1997, a Master's of Surgery, which is Shalyatantra from Government Ayurveda Medical College, Bangalore. Soon after this, he has completed his PhD in Shalyatantra from Institute of Medical Sciences, with Banaras Hindu University, Varanasi in 2004. He's also completed a yoga instructor's course with Vyasa University. Well, apart from this, a lot of academic excellence. He's published 18 articles and has authored many textbooks, which have been a very good reference for students. He's been an invited speaker at many national and international conferences, and therefore it's wonderful to have you here. And we are fortunate that you could spend the next 45 minutes with us. So thank you for coming over and joining us.
Yeah, thank you, Dr. Vasudha. It would be a pleasure to discuss and give some information regarding the present topic, what we would be discussing for the next 45 minutes.
Correct. Yeah. So audience, of course, will be waiting to hear from you, and we'll keep it a little definitely interesting, and we also keep it educative, and that's the motive anyway. We can also have a multilingual conversation, as both of us are familiar in Hindi as well, and audience can also post your questions in Hindi if you're comfortable and looking forward to answering your questions in Hindi. So do let us know, and we will now start in exploring what this whole constipation is all about. So how do we define constipation? Can you please explain this in a very simple way?
Yeah. First of all, Dr. Vasudha, there is a lot of variation in the bowel movement, whether we have to pass it every day, whether passing it once in 2 days, once in 3 days is okay, what is healthy, what is unhealthy. So there are a lot of confusions. So when you told me that I have to give an awareness regarding constipation, and you said this would be a constipation awareness month from your center, I was very happy, because this is one topic which people don't have awareness, and people have a taboo in discussing about it. So they feel it embarrassing, they feel it's not a topic to be discussed, or it's a topic filled with lot of vague answers, vague explanations, which further worsens the knowledge of a person. So bowel movement, when a person, what is the right one? See, a person, if he has to be healthy, has to pass bowels every day. So this is one of the very basic things. So whenever, see, the basic idea of passing bowels is to clear your body of toxins. There are a lot of toxins which are getting cleared. So if you're not passing it every day, basically there is a stasis of these toxins, free radicals, which would then worsen your immunity status, and gradually over a period of time you end up with various chronic diseases, which many times happen over a period of years that you are not able to really relate it to the bowel movement. So Ayurveda, which gives greater importance to prevention, clearly says that you will have to pass the stools regularly, and more than passing the stools regularly, you should not suppress the urge also. So that's also an important part. Passing it regularly and not suppressing the urge to pass the stools, both are very important aspects when you think of maintaining your health, preventing diseases. So I think this is the what a basic understanding of constipation or a bowel movement, which is healthy, which is unhealthy.
Correct. Very true. So, no, most of the people are very, very inquisitive to know what is Ayurveda Dinacharya, the daily regimen which we talk about. So, as you said very clearly, Mala Visarjana and not suppressing the Mala or the feces is very important. So, people also very commonly ask us in clinics कि नहीं डॉक्टर बहुत गैस बनता है हमको ढकारें आती हैं अगर ऐसा हो रहा है तो पेट साफ न होने की वजह से हो रहा है क्या and such things. So how do you really want people to understand this whole scenario?
Yeah, see, if a person is passing the stools, अगर पेट साफ हो जाता है तो गैस बनने के चांस बहुत कम रहते हैं. See, basically the moment there is a stasis of fecal material, there's a lot of natural gases which are formed in the intestines, which tend to accumulate, and you end up with various problems associated with it, like you may have पेट फूलना, डिस्टेंशन, कटी डकार आना या गैस ऊपर से आना, गैस नीचे जाना. See, if a digestion is occurring properly, if a person is passing stools properly, even if he has flatulence and he passes the flatters, the general understanding is there should not be any foul smell associated with it. So whenever the bowel passage is not proper, all these start coming and all start getting associated. So patient ये समझ नहीं पाता है कि मैं ठीक से bowel पास कर रहा हूँ या नहीं, लेकिन ये जो पेट फूलना, डकार आना, ये सब चीजें बोलते जाते हैं, वो अपना bowel movement के बारे में ज्यादा ध्यान नहीं देते हैं. तो जब एक बार आप इसके बारे में ध्यान देना शुरू कर देंगे तो ऑटोमेटिक देयर आर सो मेनी फीचर्स, अपने आप ठीक हो जाएंगे. यू रियली विल फील वंडरफुल. यू विल से I gave concentration to just one thing and I have got rid of so many complaints. So therefore, talking about constipation, talking about how do you understand, how do you manage it, these are something which are very basic, very important to maintain health.
बहुत सही कहा आपने. So I think very true to know that what we eat and what we drink is also very important. So it's very important for people to know that drinking water, taking fiber-rich food, which जो रेशे रहित भोजन जिसको हम लोग कहते हैं, so ये सब बहुत ही वैसे महत्वपूर्ण है. They're all very important in terms of avoiding constipation. So what is the recommended say intake of water or for a normal individual?
Yeah, this water intake is also slightly variable depending upon the type of occupation, type of physical activity, where he works, etc. You will be surprised to see that most of them really don't know what is the quantity of water to be taken. कोई ले जाता है इतना छोटा बॉटल ऑफिस, पूरा बॉटल खत्म करता है, बोलता है मैं एक बॉटल खत्म कर दिया. कोई बड़ा बॉटल ले जाता है, आधा वापस ले आता है. Some drink well if they have a knowledge of yoga or they have got exposed to some health seminars, etc. तो थोड़ा पानी ज्यादा पीना शुरू कर देते हैं. If not, you generally ask them, they say I drink very well. I say wow, very nice. Just tell me what is the quantity you drink. तो बोलते हैं सर 3 ग्लास 4 ग्लास. कितना बड़ा ग्लास? इतना बड़ा ग्लास. या इवन द ड्रिंकिंग ग्लास. तो दैट्स अराउंड 250 ml. तो 4-5 ग्लास भी आप ऐड कर दोगे तो इट कम्स अराउंड टू 1-1.5 लीटर. तो बोलता हूँ 1-1.5 लीटर पीते हो? अरे वो तो बहुत ज्यादा हो गया सर, उससे कम ही पीता हूँ मैं. तो द रियल क्वांटिटी के बारे में आइडिया नहीं है तो they are not able to drink it. So as a doctor or as a people with related to health profession, it is very important for us to educate the people how much is the healthy quantity of water. If a person has to pass proper stools, proper bowel movement has to occur, the minimum quantity of water is about 3 liters. So that means to say, if a person has to have normal urination, soft stools, pass the stools every day, then 3 liters of water is very important. And I suggest 3 liters of water, which is not including other liquids. जैसे कोई बोलता है सर मैं जूस पी लेता हूँ, कॉफी पी लेता हूँ, वो पी लेता हूँ, सब मिला के 3 लीटर. So I say that is all bonus. Have 3 liters of water over that juice जो भी होता है, that's all very beneficial to you. That will help you to have stools. See why you require water. See, basically, when the colon is absorbing water, if you drink less water, see, body has to maintain a basic quantity of water inside our body to maintain the system. जब पानी कम पीते हैं, तो intestines reabsorb the water and stools become hard. तो क्या होता है, stool जैसे ही hard हो जाता है, patient finds it very difficult to pass it out. So that starts creating, we'll discuss about it, that it starts creating various other issues. So the moment the patient drinks water, required quantity is absorbed, बाकी वो stools के साथ रह जाता है, तो stool becomes soft. So the patient is able to pass it easily. So thus the chances of ending up in constipation is very much less. So the advice I would give to anybody hearing this would always drink 3 liters of water. And especially if you are going for exercise, if you are doing gym, doing yoga, working in a place where you sweat a lot, working in a place where it's very, what do you say, dry, then you need to add little more quantity of water. But the basic line would be anything above 3 liters.
Right, because also people feel, they're drinking coffee, tea, as you said, but they are itself constipated because of
Correct.
the caffeine, and they don't understand, because everybody, especially in South India, ने थोड़ा सा सुबह पी लिया, फिर दोपहर को पी लिया, शाम को पी लिया. This keeps happening. And how much do you drink?
Yes.
No, the small coffee glass, but that itself is a larger quantity. So that's something I think which people will relate to when we are kind of discussing this. And of course, with respect to water, otherwise, I think Ayurveda also talks a lot about the quantity of water with respect to Prakriti. Like some people really don't need too much of it. So how do you think we can basically suggest?
See, Ayurveda gives importance to Prakriti. Prakriti, if people have to understand, it is our basic nature, how we are made, how we react, what are all the diseases we get. So everybody has a different make. So we cannot, just as Ayurveda says, we give medicine based on individual human. So it's not like one medicine works for one person, it works for the whole population. So we need to think of each person's constitution and give him. So according to that, if you can, to make it very simple, you have people who have Vata dosha is predominant. We say he is of Vata Prakriti. People are of Pitta Prakriti, where Pitta dosha is predominant. Similarly, Kapha, where Kapha is predominant. This is to make it very simple. Ayurvedic doctors would know it's not so simple. I am trying to make the common population to understand it. So what the people have to understand, once you understand your Prakriti, suppose you are of Vata, you always have a tendency to get constipated. So that means to say your nature is to get constipated. So accordingly, you will have to plan your schedule, plan your diet, plan your water intake, exercise, such that your tendency to constipation can be prevented. Whereas a Pitta Prakriti person, he is sensitive. Even a little change in the diet, little extra masala, thoda spicy खा लेता है, कहीं जाके थोड़ा नॉर्थ इंडियन या थोड़ा ये रोटी वोटी गरम चीजें खा लेता है, तो he has lot of bowel movements. अगले दिन 3-4 बार हो जाता है. कफ प्रकृति पर्सन ही इज ए स्टेबल टाइप ऑफ पर्सन, इतना जल्दी उसका बॉयल मूवमेंट में हेयर फेयर नहीं होता है. So a person after going to an Ayurvedic doctor or after understanding his Prakriti, he should understand whether I have a tendency to be constipated or whether I have a tendency for increased bowel movement. अगर वो जान लेगा तो उसके बाद डाइट प्लान करना उसके लिए ही आसान हो जाता है. इट बिकम्स इजी फॉर हिम टू अंडरस्टैंड, ओके, इफ आई ईट दिस, if I do this, there is a tendency. So I have to break that chain so that I don't end up in diseases. So this is something where we Ayurvedic doctors can help them. When they come to a consultation, just give them an idea that, see, you are of this prakriti. There are certain tendencies of you, certain diseases which you are susceptible to, and certain things which you can do so that you don't end up in those diseases. That would really make the life of the general public a little more healthier, little more easier to manage diseases.
Yeah. Yes, though now we cannot get into a lot of details because Prakriti is a very, very large topic and it has to be very individualized, customized. Yes, but people can always reach out to Ayurveda physicians to understand more about this and get your own diet patterns also customized according to your Prakriti. So, well, when we talk about food, fruits and vegetables are very, very integral part of the eating scenario. But not many, love fruits, but many love fruits as well. So the various kinds of people who have different likes and dislikes. Same happens with vegetables. So one, I think it's good if you can explain how roughage or fiber, जो रेशा रहित चीजें पदार्थों के बारे में हम लोग बात करते हैं, how that actually helps in improving bowel movement first, and then we can say what are the recommended fruits and vegetables.
Yeah, it's a good question. See, today people are having ready to eat food, bakery foods. Okay. These are all white flour. Okay. They all look very nice. But the moment you think of this maida, etc., they're all something which don't have any roughage at all. So fiber is something which is very, very important. See, if you see Indian food, every Indian food, especially if you think of South Indian food, you had 2-3 palya. Okay, you had a lot of what we call as kosamri, lot of raw salads type served to you on the leaf first. So you have them, and then you have the rasam, sambar, and then you have the other things. So that means to say our diet had something which was a very balanced diet where you had raw foods, vegetables, and you had the other things to eat. Now what has happened is, in a hurry or with a common thing that I have no time, nobody wants to like invest time in making salad, making palya, all this. They feel, oh, that's all side dishes. We directly go to the main dish. So if you have to digest the main dish, if the main dish has to be healthy to you, they forget that these are all very important things. So salads, raw vegetables or fruits are something which are very, very important. And another thing is, at the moment you tell somebody to have salad, na, they start making faces. उनको लगता है कि गाय जैसे खाना है, इतना तरकारी खाना है, क्या है उसमें? See, you can make it so tasty that many times you will stop eating the main course itself. The salad itself becomes so tasty. So salad of these raw vegetables and fruits, they have fiber in it, which is not digestible by us. तो उसको जब खाते हैं, तो it mixes with the bowel and makes the bowel soft. तो क्या होता है, the moment we eat this partially digestible or indigestible fiber material that comes through vegetables and fruits, you have to be happy that it cleanses your colon, makes the stool soft. So automatically you are able to pass the stool next day without much effort, which is very, very important. And it cleanses the bowel. तो पूरा जो stool अंदर जमा हुआ रहता है वो पूरा clear हो जाता है. So that way you also become healthy. And the added advantage is they do not add calories to you. So you don't put on weight by eating more of raw vegetables or fruits. So there are a lot of additional benefits of having them also.
Yeah, correct. And I think all this also is dependent on the profession, quite so that depending on what kind, whether you're on a desk job or you've got a lot of, movement in your job, a lot of walking around, people have to decide on the diet and also water intake especially. And as already mentioned, if you're in Bangalore versus if you're in Mangalore, the water intake would definitely vary. And people have to be very conscious on this. Whatever you may be doing, however busy you are. So we therefore see a lot of problems which are also coming up because of constipation, and it is not limited to just one age group. It can start from children and go up to elderly, and children are very susceptible to constipation, especially infants. We see, that infants start crying. We as parents also would have had some experience, and we would have heard it from the patients as well. Pain abdomen, or तो पेट का दर्द होता है बच्चों में. This is a very common problem which new parents acquaint, and it's not easy to manage the child when you see such a problem. So how can we really help infants or educate parents to say what's the care they need to take to help to see that the infant probably is not constipated? I'm talking about maybe infants between 6 months to 1 year plus, because until 6 months they're mostly on breastfeed.
Yeah. During breastfeeding, actually, you can't put add on with fibers, fruits, vegetables, etc. until and unless the child starts really having the बाहर का खाना जब खाना शुरू हो जाता है तो you can add all these. So till then what we advise is, or even in the children, say a little amount of in between you can give little warm water. So especially after the child starts having little additional food, you can add little jeera to it, or you can add ajwain to it. So these are all in small quantities when you do. So the basically the colicky pain of the abdomen, जो बोलते हैं, that gets relieved. The child passes the flatus easily. And once the child passes the flatus, तो थोड़ा bowel movement भी आसान हो जाता है. See, bowel movement is occurring basically by the peristaltic movement. So before you asked about the infant problem, you told a little about occupation. So this occupation is very important, which many people don't realize. कि पूरा दिन बैठे रहते हैं. अब जैसे बैंगलोर में सॉफ्टवेयर कंपनी में जब बैठते हैं तो पूरा सुबह से रात तक बैठे रहते हैं, 14 घंटा 15 घंटा, उनको पता ही नहीं चलता है. And moreover, they are sitting in a AC office where they don't sweat. तो क्या होता है, they don't feel thirsty. So whatever they are drinking is forcibly with lunch, a little with some snacks, etc. So they don't feel thirsty at all. तो क्या होता है, they don't drink water. Number one. Number two, they go have something from the pizza corner or from the burger corner where it may not be really the fiber rich breads or buns there. And whenever they are sitting for a long time, sedentary lifestyle, तो क्या होता है, basically the peristalsis जो बोलते हैं intestinal movement, वो slow down हो जाता है. Even in the children, when the children are supported to do activities, physical activities, बहुत बार फिजिकल एक्टिविटी के नाम पे बोलते हैं कि बच्चे हाँ घर में घूमते हैं, गेम्स खेलते हैं, वो सब. See, these are all again sedentary until and unless they go and do an outdoor activity or something. So they are not doing activity, and once there is no activity, the peristalsis also slows down. See, when you are doing activity, when you are active, intestine is also active. Intestine is also working well. The moment you become slow down, you are like in a sedentary mode all throughout the day. पेरिस्टाल्सिस स्लो हो जाता है. जब पेरिस्टाल्सिस स्लो हो जाता है तो जो बोवेल इंटेस्टाइन से पास होता रहता है वो स्लो हो जाता है. जैसे ही वो स्लो हो जाता है, वाटर अब्जॉर्प्शन ज्यादा हो जाता है. देन यू एंड अप विथ हार्ड स्टूल्स, यू एंड अप विथ कॉन्स्टिपेशन and lot of other related diseases. So having basically enough quantity of water, and like Ayurveda says, warm water, थोड़ा गर्म पानी, उसमें अगर हो सके तो थोड़ा जीरा डालना या अजवाइन you add, and you have that na, it basically stimulates your digestive metabolism. I can say Agni in Ayurveda, we say it is as Agni, the metabolism, what you say, that is maintained well. तो इसलिए गर्म पानी पीना is something like a nectar, amrut, what we say. It keeps you healthy, especially the health of the GIT can be maintained very well by having warm water or hot water. So this is something which you can always advise to the people. The people can also follow, especially if you are working in a very cold atmosphere like in AC workplaces where there's hardly any sunshine coming on to you. So in such places, what you can do is to keep your metabolism at a higher thing. You can have warm water, so that will help you. That can also help you to overcome कॉन्स्टिपेशन। बच्चों में भी थोड़ा हल्का गर्म पानी देंगे ना, तो जो गैस का प्रॉब्लम है वो क्लियर हो जाता है। वंस दैट फ्लैटुलेंस इज सेट राइट, तो थोड़ा बहुत बाउल मूवमेंट अच्छा हो जाता है। सो दिस इज समथिंग विच कैन बी एडेड ऑन टू द लाइफस्टाइल। ये नहीं कि जब आप बीमार पड़ते हैं तो गर्म पानी पीना है। बहुत लोग बोलते हैं ना, so you have fever or something, your mother or grandmother says drink hot water. So it's like hot water is always related to only a disease. They don't understand that by drinking hot water they are becoming healthy. उनको लगता है
It
गर्म
should be
पानी पियो तो,
a thing in daily practice, is what you're trying
yeah,
to say.
you tell them drink hot water, they say I am not diseased, I am healthy. तो ऐसा नहीं होना
Correct.
चाहिए. You add it on to your daily schedule so that you don't end up in disease. So this people have to understand and they have to start following so that they don't end up in a disease, then come to us, then we tell them to drink hot water, then they go back and start having hot water. They do it such a way that they don't end up in disease. This is the aim of Ayurveda also. It is not that you get a disease, you come to me, I treat you. Ayurveda is such a, I can say it's not utpreksha, it's not boasting. It's a science which gives lot of importance that you don't end up in disease. Our science does not say you become diseased, then come to me. It says don't get diseased at all. So only we have a separate subject called Swastavritta, which tells you how to lead your life. What is the food you need to eat so that you don't end up in disease. So that those principles are somehow vanishing. People are not following it, because of which they end up in various diseases like simple constipation, and after that a chain of diseases, and they start suffering.
Yeah, we see large, increase in lifestyle problems also these days. And I think last 10 years have been really, there's been a good extreme surge in problems such as diabetes or hypertension. So these are some background reasons for which probably there's an increase, and people are also not aware, how they can manage themselves with diet or exercise, of course, inclusive yoga and more things. And also, constipation is one of the problems which can lead to these problems such as diabetes and hypertension. That is also something which people do not understand. And as I already explained, it's very important to see, as Ayurveda says, swasthasya swasthya rakshanam. So first, you talk about prevention, and then later is what we talk about management of a problem. So rightly, understanding how lifestyle disorders can also be prevented by keeping your gut health good. And see, constipation, otherwise, now we said adults, we spoke about children, but it's also seen in pregnant women. And many women during pregnancy suffer from a problem like piles or hemorrhoids, which is very commonly seen. And during delivery or post delivery also, they face these problems. So what are some tips which you can give, for a pregnant lady and for somebody who is just delivered, so that they don't get into this problem at all? And especially in Indian population, we see a lot of this, because the grandmoms or the mothers say, nahi, बहुत आपको you have to take something, जो गर्म चीजें हैं उनको खाना है, you take some pepper, or you take few things like this. So what is your thought, and how do you think people should get help?
Yeah, see, pregnancy is a unique problem. क्या होता है, जैसे ही पेट में बच्चा बड़ा होता जाता है, so it basically presses upon the rectum and the intestine. So obviously, as the rectum is getting pressed, there is stasis, the stool is becoming hard, especially as the pregnancy is in advanced stages. There is a greater tendency for them to get constipated, and as a result of which they are not able to pass the stools properly. And once it is hard and they put lot of pressure to clear it, they commonly end up with a very common problem called as fissure in ano. To put in very simple words, fissure means a cut. So they have a tear or a cut in the anal canal, which is obviously a very painful condition. तो pregnancy में क्या होता है, many pass through lot of issues with that. Some have very bad nausea, some have no appetite at all, some have associated diabetes, gestational diabetes, etc. तो बहुत सारी problems भी associate हो जाते हैं. फिर भी suppose they want to be healthy, one of the thing is the water intake. See, as much as possible, she has to have good water intake, especially warm water. Or I also prescribe them to take ghee with hot water or ghee in their diet. As you know, ghee is something which is many times a very what to say, maligned material. It gets bad name. See, ghee, especially medicated ghee, when you take it in a proper quantity, it is very very healthy to us. तो क्या होता है, जैसे लोगों को बोलो आप you have ghee, all this cholesterol, all these things come into their mind. Oh, you are telling me to have ghee and my cholesterol will go up. That person said not to take this. Ghee in a very correct quantity is something which is very very important. If you go through Ayurveda, ghee is something which is to be taken every day. That is not only required for maintaining your fire, the metabolism, what is required. See, just as they say, when you have to keep the fire burning, you need a fuel. So that fuel is also ghee along with the food. So that ghee helps you to keep the digestive fire well, helps to keep the gas problems, etc. It keeps you away from that. So especially in pregnancy, if you can take a little ghee, a little hot water, okay, little giving more importance to having salad, etc., avoiding these junk foods. You know, they have all this tendency to have very spicy food, they have those desires. But along with that, if you can add little fiber quantity into your diet, a little of milk, warm water, a little of ghee, all these when you add on to your lifestyle, pregnancy also is not creating problem. And post pregnancy delivery, you said there are a lot of, if you see, Ayurveda gives importance to Sutika Charya. There is something called as Sutika Charya. If you go to an Ayurvedic doctor, they'll tell you certain do's and don'ts which you have to do after delivery. This was known to mothers, grandmothers, and we didn't have to tell. Today, doctors are telling. Why? Because mothers and grandmothers have forgotten it, and many times the doctors also tell don't do it. When you do it in a proper way, you don't end up in problems. That's actually very important for the mother to get back her health. So if you now today go to a doctor, Ayurvedic doctor, they'll tell you very detailed diets and regimen which you have to follow after delivery. If you do that, you don't end up in constipation. If not, post delivery fissure is a very bad problem. Constipation leading to fissure is a very bad problem. See, I being a proctologist, I see most of them ending up with fissure, sentinel tags, then coming for surgery, then coming for Ayurvedic treatments, trying to avoid surgery. So that's a big chain which happens. So maintain your bowel movement during pregnancy, then post, once you have delivered, follow a very healthy diet, then you don't end up with all these diseases. So pregnant women need to take extra care to avoid constipation.
So, well, no, definitely it's a concern post-delivery as well. But we also see piles, commonly hemorrhoids, and then fissure or fistula in different age groups in the population. And mostly, when they have a problem, the first thing they would do is probably go to a rectal expert. But people are also not aware that Ayurveda has got a very specialized, area where we also talk about treatments for rectal diseases. So basically, how can people avoid surgeries when they're indicated for a hemorrhoidectomy or a fistulectomy? I think, and since you specialize specifically in this, people should know about this.
Yeah, it's a nice question. See, I've done my PhD also in the same subject, and I've been practicing from the past 17, 18 years in managing anorectal diseases with Ayurvedic management. See, the first thing is once they have constipation, they have to understand that they are suffering from a condition and they have to come and get diagnosed from a proper doctor. That's very, very important. It so happens the neighbor tells you certain things which is more valuable than diagnosis by a doctor. This is something which is sometimes very pathetic in our practice. I feel bad to tell it on this media. हम लोग बोलते हैं लेकिन बगल वाले जो बोलते हैं ना उसका एडवाइस ज्यादा वैल्यूएबल हो जाता है, तो हम लोग डॉक्टरी पढ़ के our advice is sometimes less valuable. So I would tell the people, just go to the right doctor and first get the correct advice. What are you suffering from? Whether you are suffering from fissure, see, all diseases of the anorectal region ना उसको बोलते हैं बवासीर हो गया, उसको पाइल्स हो गया. It's not like that. There are different diseases. You have fissure there, you have hemorrhoids there, you have fistula there, you have certain very I can say bad diseases like cancer there. So क्या होता है, सबसे पहले you have to get it diagnosed. तो सबसे पहले go to a doctor. Go to a doctor, find out what the reason is for constipation. Get yourself examined. If there are no diseases, very good. Make changes in the lifestyle. Take lot of water. Take lot of raw vegetables and fruits, and changes in your lifestyle by adding few exercises, avoiding staying awake in the night for very long time unnecessarily. So ये सब जब add होता है ना, the constipation gets right, you get up freed from anorectal diseases. Next step is you have certain anorectal disease, like you may have fissure, you may have hemorrhoids, you may have fistula. Once you have gone to a consultant and you have understood the disease, the doctor would advise you certain things. Follow it meticulously so that it gets set right in the initial stage. Next, if it has reached a stage where surgery is indicated, as an alternate to surgery, there are many Ayurvedic treatments available. Like in Ayurveda, if you see, we have scientifically proven treatment called as Kshara Karma or Kshara Sutra therapy. This has been accepted even by the Western science as a very safe and effective management. And this is not something which is told today. It was told 5,000 years before in Sushruta Samhita. So surgery is not something which is of the Western science. Surgery is something which is there from Ayurveda. I have done my master's in a branch of surgery which is called in Ayurveda as Shalya Tantra. So many times when people ask if surgery is there in Ayurveda or not, so Ayurveda is the Sushruta who is there from Ayurveda is called as father of surgery. So surgery is a very integral part of Ayurveda. But we have better or effective, minimally invasive surgical techniques like Kshara Karma and Kshara Sutra, which are not associated with much of complications which a person may undergo if he undergoes surgery. So whenever you end up with constipation, whenever you end up with bleeding in the stools, whenever you end up with some discharge with the stool, it may be a mucus discharge, it may be a pus discharge, don't stop yourself from getting yourself checked up with a doctor. Go to a doctor, go to a surgeon, allow him to check that area. He will make the right diagnosis, and depending upon the stage, he will either tell you a medical management or he'll tell you a surgical management. And as an Ayurvedic doctor, we have an additional treatment apart from surgery, which is a minimal invasive surgery called as Kshara Sutra or Kshara Karma. Come to an Ayurvedic doctor, undergo the treatment, and get freed of the disease. Don't be hesitant, because one disease can lead to various other diseases wherein treatment may not be possible. And then it becomes very, very bad. You start feeling bad about your condition. So don't prolong it, don't postpone it. Get treatment at the earliest. If not treatment, get a advice from a right doctor at the earliest.
Yeah, what people should take care is they should not wait until they see some complications of the particular problem. And commonly what happens is we see a lot of quacks. We see especially boards saying poison fistula clinic. People many times get succumbed to this situation. So they need to understand who the right person. And also not all Ayurveda doctors perform Kshara Sutra therapy. And there are people who are trained in this, or as you said, people who have done the masters in surgery like what you have done. So it's good to approach a specialist in the field as well, and it's good to accept that specialists can do their job because they're meant to do that. So when it even comes to common problems such as fissure, they have pain while passing stool, then they just neglect it for a few days, then it gets worsened. But there are Ayurveda medicines to begin with simple things like sitz bath. So, can you just throw some light there as well?
See, fissure, as the English meaning also says, is basically a break or a tear. See, the lowermost part of the anal canal is covered by skin. Skin, is very sensitive to pain. So whenever there is a tear there because of the passage of hard stools, they end up with a tear, end up with a wound, which is very painful, associated with bleeding. To tell you a little about fissure, the cause of the fissure, apart from constipation, is when a person sits in the washroom and strains unnecessarily. You may be surprised. Many of them don't know what is the healthy time to sit in the washroom. The healthy time to sit in a washroom to pass the bowel is just 3 minutes, 3 to 5 minutes. If you go across the population and ask them, nobody comes out in 3 minutes. You have people taking music systems there, hearing, reading newspapers, smoking, coffee, tea, what all. It's a place where you are not supposed to do that, and people do a lot of things there. So the moment you are doing that, you are deviating yourself from the act what you have gone for. You have to do it, finish it in 2 to 3 minutes, come out. See, mucous membrane is very delicate of the anal canal. It's like your lips. If you are unnecessarily stretching it, it is obvious that it's going to tear. And once it tears, it's obviously going to create a lot of pain. So unnecessarily don't strain there. You go, clear the bowels, come out within 3 minutes. So this is something which they have to understand. And once they end up with fissure, see, it's a wound in a dirty area. So it takes a lot of time to heal. So as you said, sitz bath is something which is very important. Sitz bath is nothing but you take a wide plastic tub, fill it with warm water. You can add Triphala Kashaya. You can add Panchavalkala Kashaya to that. These are some Ayurvedic medications I am telling. You can always, the general public, you can always approach an Ayurvedic doctor. They would advise and they would help you out with these kashayas. Why I'm telling kashayas? These kashayas have very good wound healing property. They prevent infection of the fissure wound. So you don't have to rely many times even on antibiotics also. So they can help you so well. So you sit, have in the tub filled with those kashayas. So that relaxes the sphincters. It improves the circulation. So the wound heals faster without any chances of infection. Why? Because if the fissure doesn't heal on time, it becomes infected. Then it results in fistulous abscess in that area, boil. Then it leads to another complicated disease called as fistula. So it is a chain of unwanted conditions which can happen. So it's not sitz bath alone which is enough. There are many other medications which would be required, which could help in managing the pain, which could help in alleviating the bleeding, which would help in easier stool bowel movement. And there are many drugs which many times may have to be prescribed to even prevent infection and wound healing. So thus, when you treat them as a whole, the fissure can be very easily treated by Ayurvedic conservative management. Conservative management in the sense just by medicines without the requirement of surgery. But you need to approach it as early as possible so that you don't end up in complications.
Yeah, and this holistic, method of healing definitely includes vyayama or exercise, as we always say, it's essential, and which includes definitely yoga. So yoga also talks about a lot of different asanas which we use, but primarily it's just not limited to asanas. It's also, a lot about stress, because many times stress is one of the major factor for leading to problems such as constipation. A person may be drinking 3 liters of water, maybe doing some good exercise, but stress is so bad that he still gets constipated. So yoga is definitely one mode of intervention which is essential for people with constipation or piles, fistula, or fissure kind of health problems as well. So would you like to also give some tips here, Dr. Rajneesh?
This switch on, switch off mode is something which is very important. They carry office stress to home, carry home stress to the office. So it so happens that most of the time they don't know to switch off from stress at all. Always on stress. They come home, They're on mobile, they're on TVs, they're on social media. I see people uploading reels on Instagram at 2 o'clock in the night. I really don't understand how is this possible when you want to stay healthy. See, if that is the important goal of life, then you are sure going to become diseased, and you will come to people like us. So, but if you don't want to get diseased and take our services, these are not lifestyles which you should be following. You should follow an healthy lifestyle. Healthy lifestyle involves switching off from the stress, where yoga plays a very important role. Many times you don't understand. People think that yoga is an exercise. I say, do yoga. They say, sir, I'm doing gym. Yoga is not gym. Gym is not yoga. So this is something which people have to understand. Yoga is not only asana. If you go and start learning about yoga, yoga is not physical exercise where they ask you to lift leg, bend your leg, sit in this posture. There are many intricacies involved where you need to concentrate on your breathing, concentrate on coordinating between your breathing and the postures. Then dhyana is there. Then the respiration is there. How do you respire? How slow you have to respire? So when you do all these, automatically the stress level also comes down. Whereas in a gym, it may be just a deviation, just a physical exercise, but they don't, what do you say, think about the stress. So yoga, it's not only about, say, I do Vajrasana, I do Pavana Muktasana, I do this asana, etc. But you need to meet a yoga counselor, yoga therapist, learn all the parts of yoga, not one part of yoga and say that I'm doing yoga. It's just a asana. Asana is not only part of yoga. There are many parts of yoga which, when you follow as a whole, it reduces your stress, it improves the circulation to your body parts, including the GIT in the sense the gastrointestinal tract. It improves bowel movement. So automatically you start overcoming lot of diseases. So when you go to an Ayurvedic doctor, you are lucky that Ayurvedic doctor not only prescribes medicine. It's a, what do you say, an innate behavior that he starts advising you, preventing things. He starts advising you certain yogic postures. Learn it properly from a right instructor, person who has learned yoga, add on yoga, and then follow the advices which the Ayurvedic doctor tells you, and overcome the disease. So it's all a part and parcel of the treatment rather than taking it as individual. Just add on everything that gives you a lot of benefits.
Yeah, so this is what is called as yoga therapy or therapeutic yoga, where we
Yeah.
focus on all the different aspects, and it is based on the Panchakosha concept, which yoga, the Upanishads talk about. And of course, at our centers, we therefore combine a lot of Ayurveda with yoga therapy compulsorily to get the best, out of what we do. Well, I think we are also just at the brim of closure. So we've taken up a lot of questions, and the questions actually were received when we sent in this information to a lot of our clients and people who would like to hear from these kind of sessions. So we really had a good educative question and answer session, and had a lot of inputs from you, Dr. Rajneesh, and this was really needed for people, because whether they watch us now or they watch us later, it's going to be on YouTube for everybody's reference. And it's essential that people adapt proper intervention on time. Especially, you also should know that Ayurveda offers a lot of treatment for such problems. As we said, the awareness is what we are trying to develop on the same, and there are specialized therapies such as Doctor mentioned, such as Kshara Sutra, and all these can really help you improve your quality of life if you have any anorectal problems as well, or if you're facing with any digestive problems. Definitely take care so you don't fall into this bracket of people having anorectal problems. So therefore, if you need any help, you can write to us at info@vivekanandahealth.com. We can connect you to Dr. Rajneesh as well if you're keen on. I think for today, we will have to wind up this session because of course, the time constraint which we have. So it was really nice that we had you today, Dr. Rajneesh, and thank you very much for your time once again. Thank you.
Thank you.
Namaste.
It's my pleasure. Yeah,
Namaste,
thank you.
everyone.